Well, thank you everybody for joining us today. For those of you who are watching this live or recorded and may not know either of us, I'm Emily Taylor. I'm an attorney here in Phoenix, and I am thrilled to have Cynthia McCluskey with us. We're lucky because Cynthia's an expert in all things. I know that's a big, big hat to wear, and I'll let you give a little bit of your own personal background and story, but I'm so grateful for your time and helping us kind of learn about how our family's health insurance is impacted over time and how things might change, not just day to day in the world we live in, but also as it relates to our personal timeline. So thank you, Cynthia, for being here. I'm going to let you take the floor and I might pepper you with a question or two as we go.
Awesome. Well, thank you. I'm going to give a little bit of background on me. I am a licensed health insurance agent, so I'm an expert in healthcare and systems of care. But I've been a Medicaid advocate for 24 years. My son's 27, and he had ALTCS DDD till he was 11. Um, and then I was one of the 6 moms that passed the autism insurance legislation in 2008. And Governor Ducey had appointed me to a committee where we reworked behavioral health benefits for autism within the ALTCS system. And I'm currently an advocacy director for Autism Society. So I love this subject, and I'm going to try to make it interesting and not too overwhelming. So let's just get started. So we're going to cover access, ALTCS, employer plans, Medicare, who pays first, TPL billing. So TPL billing is third-party liability billing, which sounds complicated, but I promise you it's not that complicated. And then we're going to talk about how to plan for your future for your child and what to consider when you're looking at your insurance. So first, access. So access started, believe it or not, in 1982. We were the last state to join Medicaid. And some people think that's because we had like an attitude problem. But in actuality, Arizona had their own kind of made up Medicaid program for many, many years before the feds came out with their Medicaid program. And some of the issues that we have with access is that we have carve outs and layers from programs that existed before Medicaid and then programs that exist now with access and Medicaid. So our system can be a little bit more complex than other states. And we have a very unique waiver. It's the waiver 1115. It's a demonstration project waiver, and it gives us more freedom than some other waivers. Our waiver will be up for negotiation and possibly change between 2026 and 2027. So we're currently in conversations with advocates and legislators and the government about things we can do to make our waiver solid and strong. So if you have access, so that's just straight Medicaid. So most people qualify for Medicaid based on income. You're going to get this general medical coverage. So doctors, prescriptions, specialists, hospital care, everything that you would normally think of as medical coverage. And that does include behavioral health services. Some things that will not be covered are glasses, dental, hearing after you turn 21. And we'll talk about that a little bit more later. But primarily, those services are only covered for 20 and under. EPSDT is why you have those services for 20 and under. So that's early periodic screening, diagnosis, and treatment. And what the federal law says is if you can prove that something will ameliorate your child's condition, then the state has to pay for it, whether it's a covered benefit or not. So many states have gotten things like hyperbaric chamber approved for, let's say, Down syndrome or CP, because they were able to prove that it ameliorated their child's condition. Usually you have to sue the state to get something like that added. We don't have that in our state. However, we used EPSDT to argue with the state that they should be providing behavioral health services like ABA, floor time, um, cognitive behavioral therapy, all of those things, relationship-based therapies, those should be covered. And in 2014, we had a long conversation with the governor, and he appointed a committee where we were able to add a lot of additional services using the argument of EPSDT. So what's important to know about this is that EPSDT is a stronger rule than maybe your employer plan. So there's some things that maybe your employer plan will not cover, but you can use EPSTT and the Medicaid system to get that coverage. One thing that I recently found out that I don't think many people know is there are some services through Medicaid, not ALTCS, but just regular Medicaid that you can get. So a lot of times with ALTCS, you'll have habilitation and respite. These are provided through the access plans on the behavioral health side. So you can get skills training and development, unskilled respite, home care training, and also family therapy is covered through access only. This is something I think most people don't know about, and I've included the codes that are covered. So I'm trying to raise awareness that there are some additional services that maybe people don't know how to access if they haven't yet qualified for ALTCS. So just something to keep in mind. ALTCS, there's two parts of it. So think of an umbrella. The umbrella is access, and there's three programs under access: regular access, ALTCS EPD, and then ALTCS DDD. So each has a pass tool that you have to go through and answer and score appropriately. And then each looks at resources to make sure that you would qualify for that program. This program covers more than access. So ALTCS, Arizona Long-Term Care, covers services for people that might need to be institutionalized. So you're going to see additional coverage like assisted living, adult daycare programs, case management, assisted technology, attendant care. So employment, habilitation, these kinds of things. Home modification. Someone just asked me the other day about home modification. If you have a safety issue in your home, you can ask for help with taking care of that. And DDD does have a program where they work with ALTCS to do that. So that's something that if you're having trouble getting and you need, you would want to call the DDD customer service line. I find that most support coordinators don't know this program and so don't help families with it. So you just get this extra coverage. One other thing that you get is that you get $1,000 of dental if you're 21 and over. That normally would not be covered under access. It's not a lot, but at least it's a little bit of coverage. But you still don't get hearing or vision, glasses, or hearing aids with the ALTCS. You probably have an employer plan as well. 50% of all people with DDD ALTCS have an employer plan. The first thing we need to know about your employer plan is if they're self-funded or fully funded, because the rules are different. So a self-funded policy is usually a large company located in many states, and it's the employer funding the healthcare. So they will hire a third party like Blue Cross or United to implement their plan, but the funding source is the actual employer. And the reason employers do this is to avoid state mandates. Because it gets very confusing to design a plan if you have to follow state mandates and every state is different and you have employees in a variety of states. So they are governed under federal mandates, not state mandates. Fully funded policies are more traditional. You'll usually find them within smaller companies or only located in one state. That's where an employer buys a plan from United or Blue Cross or Aetna, and it's less risky for the employer. Fully funded plans have to follow whatever state mandates exist for that state. Believe it or not, when my son was diagnosed, my husband had an amazing insurance plan and nothing was covered because autism was an exclusion. So starting in 2001, we started to see legislation go from state to state that made it so they could not make autism an exclusion anymore. In our state in 2008, there are 6 of us moms, went down to the legislature with our children, and we argued for this bill, and we were successful. As of 2025, all 50 states have had legislation pass. When you think about it, back in the day, autism wasn't considered treatable, and so it didn't seem like it would be worth paying for treatment since you couldn't get better. We know that that's not true anymore, so I'm excited that this has passed in every state. One of the other things that we now see in most self-funded policies, you will see that you will have the coverage even though there was never a federal mandate. So if you work for a self-funded policy company, you can pull that language. I pulled my husband's, and ABA, which was always an exclusion, is a covered service with no limitations. So we've seen a change in the last 20 years in even being able to use our own employer plan insurance. And we're going to talk a little bit more about who pays first and all of that, but let's keep going. So, if you have a child that is disabled, DDD ALTCS, if they turn 18, you can apply for SSI, and Autism Society has classes. I teach classes on this. But if you apply for SSI and the adult child's unmarried, and one of the parents is either on SS retirement, SSDI, or is deceased, this adult child will qualify for the DAC program. So you will get SSDI on the parent's work record for 24 months, and on the 25th month, they will qualify for Medicare. And the way that you will find this out usually is a Medicare card will just show up out of the blue. Usually families don't know why, they don't know what to do about it. It's overwhelming. And then the next thing that's going to happen is you're going to get a bill from Social Security that says you're going to have to pay this Part B premium. And that is not the case. One other thing I want to point out is if both parents pass away, the adult child will get 75% of the parent's full benefit, whichever is higher. The other thing is if a parent, let's say, is lower Social Security and the child gets their SSDI on that parent's work record, when the other parent who has a higher amount retires, it can be switched to the higher amount. There's this thing called the pickle rule, and the pickle rule protects the individual from losing their access or ALTCS because their SSDI amount is higher than their SSI amount. So a lot of times people are afraid when they get this higher amount that that's going to mean they're going to lose their services, and it does not. However, you have a $2,000 limit of assets. So you need to make sure that you're spending that money or you're putting that money in an ABLE account, but you can't just save that money. If they find out that you have more resources than 2,000, you are absolutely in danger of losing ALTCS. And there have been a few families who just weren't paying attention where they lost their ALTCS and we had to help fight to get them back in the system. So you just really want to make sure that you're paying attention. Again, the Part B premium, whether you're on Access or ALTCS, if you're on SSI, then that premium is paid for by Access or ALTCS. There's a program called the Medicare Savings Program, and I help people with that all the time. But what I want people to know is do not cancel your Part B because you're worried that you're going to have to pay that amount. They're not going to have to. And depending on the circumstance, they cannot reject Part B. So if your adult child has an employer plan with you, Medicaid, and they also get their Medicare, you can choose to reject Part B, but there's some things that we should talk about before you do that. If they don't have an employer plan and they have Medicaid, they have to have their Medicare, both Part A and Part B. When you qualify for Medicare and Medicaid, you do have some choices. You can select a dual Medicare Advantage plan. That's where everything's coordinated together. You can select a Medicare Advantage plan that's not dual, that might give you a wider range, a network, but might have less enhanced benefits. Or you can choose to have Medicaid and Medicare and a prescription drug plan. And Medicare doesn't have a network, so it does give you a wider network of people to see. But Medicaid does have a network, which means that they won't always pick up that 20%. Sometimes it makes sense to do this. What's really important before you make any decision is to check all your doctors and your prescription drugs. And that's something that I will do for free. And I'll tell you what doctors are in which network so that you can make an informed choice. So who pays first? Medicaid is always the payer of last resort. And you also have to remember that every access and an ALTCS plan is an HMO. So it's important to get referrals and it's important to stay within that network. You don't always have to, so let's talk about that. If you have an employer plan, you can see somebody in network, and what that means is the employer plan will pay first, and ALTCS will pick up copays, deductibles, all of that, and you can absolutely not be balance billed. If you're in network for your employer plan, but you're out of network for access, it's a little bit more complicated. If the provider is access registered, then the employer plan will pay and the provider will have to bill access or ALTCS, and they cannot bill you. It does not matter if the provider has a contract with United or Mercy Care or whoever the plan is, they can bill access. They generally are not thrilled to do that, but it's really important that you check to make sure somebody is access registered. There is an exception to this. You can sign that right away and give them permission to bill you, and you want to think very carefully about whether you're willing to do that. We have heard that sometimes when a provider finds out that you have access, they won't want to see you, especially if they're access registered because they know they can't balance bill you. So you are not required as a family to tell the provider that you have access. You just have to understand what you're doing and what the implication is of making those choices. If the provider is not access registered, then the employer plan will pay and access ALTCS plan will not be billed and you will be responsible for copays and coinsurance. This isn't always the case, but in general, there's always some unique circumstances. So I'm just talking in a broad sense right now. So let's say you have an employer plan Medicare, and Medicaid now. Who pays? If your employer plan has over 100 employees, the group plan will pay first, Medicare will pay second, Medicaid will be paid last. If your employer plan has less than 100 employees, Medicare will pay first, the group plan will pay second, Medicaid will pay last. If your employer plan has less than 20 employees, Medicare pays first, employer plan pays second, ALTCS pays last, and the employer plan may not pay anything at all if you don't have Medicare and you're entitled to it. So you really want to be very careful when you're looking at your employer plan, Medicaid, and Medicare, and what you choose to do. Another thing that you want to consider is how much are you paying for your employer plan? If you're paying a lot of money for the employer plan, it might be worth doing Medicare and Medicaid and looking at your additional choices. Again, though, we have to think about providers. There are times where you have providers that are on your employer plan that you're not going to find on Medicaid or Medicare or the dual plans or a Medicare Advantage. So before you decide, it's important to look at network of doctors, who's really important, the cost of everything, and really doing an analysis of what makes sense. The other thing is you're not going to work forever. So you do have to have a plan to transition to these government programs because they're not always going to have your employer plan. I can help you figure that out because you don't have to do it right this minute, but you do have to be thinking about this. If you have a Medicare Advantage plan and Medicaid, so let's say you have an Advantage plan that's not a dual, the Advantage plan will pay and your Medicaid will be payer of last resort. So let's say you picked a PPO plan because it has a doctor that you love who doesn't take Medicaid. Probably the rest of the doctors will be in the network, so you're not going to pay anything for everybody else, but for that one doctor, you might have a copay because they're not registered with Access and they're not contracted with Access. So some families choose that. If you have a dual plan, you never even have to worry about coordination of benefits. It's all coordinated for you. The network, however, is not the same. A dual plans network is not the same as a Medicaid network. We have found that there's about a 10% difference in providers. There are some providers on the dual plan that are not on the regular Medicaid plan, and there's some providers that take the Medicaid plan that don't take the dual plan. So you can't just assume that if you're on a Medicaid plan and you pick the dual plan that everybody's going to be in that network. It may not be so. Here's some things Medicare does not pay for that might surprise you. Medicare does not pay for ABA therapy. A BCBA cannot be registered with Medicare because Medicare does not consider ABA therapy to be a covered service. Speech services with a speech path assistant are not covered by Medicare and they cannot bill Medicare. If you have Medicare and you want to bill Medicare, you have to see a speech path because they're the only ones that can bill Medicare. And after this, I'm going to talk about an issue that we've had this last month regarding this, but so we'll go into more detail. Long-term care services are not covered. So a lot of those ALTCS services that you're getting, like the day program and assisted living and assisted technology, transportation, none of those things are covered by Medicare. Case management is not covered by Medicare. Non-emergency transportation, home and community services, employment services. So you can have a dual plan and also still get these services, usually through DDD. And so you get some services from the health plan, some home and community services from DDD, and it should not affect it. But it's just important to know that there's some differences. So third-party liability and pay and chase. Medicaid is payer of last resort. So if you just have Medicaid, that's one thing. Nothing has to be done because you have to go to in-network people with Medicaid, and Medicaid picks up those bills. But if you have an employer plan, or you have Medicare, or you have both, what the state is supposed to do is bill those people first. So if you have a service, then they need to bill your employer plan, Medicare, and then DDD or the Medicaid health plan could be billed. If you're 20 or under, the state has to pay and chase, which means they have to pay and then they chase who might have to pick up that bill. This is important because the state forgets that they have to pay and chase sometimes. So if your child's in the hospital and they need mental health services and your employer plan has in-network, but it's not the same as Medicaid, and you're in the hospital for a period of time while they fight it out, that's not supposed to happen. You should be able to have your adult or child put, as long as they're under 20 or under, in a facility, and Medicaid pays, and then they chase your employer plan. So that's an important word, like phrase to understand, pay and chase, because a lot of times that's where you're going to see services denied because they're trying to work with your employer. Your employer plan, having an employer plan is not supposed to put you at a disadvantage. So just make sure that you understand that. We have had some issues lately with DDD. April 1st, they implemented a policy that passed many years ago, but they hadn't really implemented it. And they suddenly demanded that everybody have a Medicare contract, which is not that easy to get. Most of the providers don't have the contract because they can't bill Medicare anyways. And what happened was anybody that had Medicare, they were billing Medicare, and then they get denied, or they wouldn't even get a denial because they don't have a contract. And DDD just stopped paying for all of these people. So that's not good. What we first heard from speech paths, then we heard from occupational therapists, then we heard from PTs, then we heard from home health. Then what we heard is people with primary care were seeing denials of the providers were seeing denials of claims. We think this is Medicare only. So if you had Medicare, an employer plan, and then DDD, we were seeing denials of claims. So we all of a sudden had all these providers that as of April 1st were not being paid. And nobody really understood why. And the reason that I got involved, because I don't advocate for providers, is because one of the providers had this idea that they were going to tell all of their clients to drop their Part B. And I was contacted to see if that was allowed. And I'm like, no, you're not allowed to do that. And this is a really bad solution. Let's figure out what the problem is. So we have been working with DDD and Access, and the problem has been fixed as of last Friday. And all of those agencies and companies are now going to have to resubmit all of their billing from April 1st and on, or any TPL billing that they had prior to that. So there are some agencies that are going to have to submit 6,000, 7,000 claims back to DDD again. So this was not a small blip in the system. We are requesting that DDD and Access actually put together a TPL committee. I'm asking to serve on that committee. We want some providers, some advocates, some insurance experts, the health plans to participate, so that when we implement these policies, we make sure that we're doing it in a way that doesn't jeopardize the network and doesn't jeopardize our members from getting the services that they need. So what should you do? When should you drop your employer plan? Some people, when they qualify for ALTCS, they say to themselves, I'm just going to drop my employer plan and I'm going to just have ALTCS. You can do that. You just have to understand what you're giving up and make sure that you want to give that up. Medicaid does not travel. So if you wanted to see an expert in California or New York, that's not something in general you could ever do. The only way that you could make that happen is if you could prove that there was nobody in the state that could provide that care. That's pretty hard to prove and difficult to make happen. It can, it's just really hard. So first you want to think about how much freedom do you want? How much control do you want over your child's care? What does your employer network look like versus the network within Medicaid? If you're paying a lot of money and you can't afford it, that's something to take into consideration. If your child has Medicare now, then we're going to look at that again. We're going to look at the network. We're going to look at the cost. We're going to think about when you're going to be retiring. We're going to make sure that we're doing transitional planning for coming off that employer plan, because you'd be surprised how often the doctors on the employer plan will not be a choice when you go to straight Medicaid or you go to a dual plan or a Medicare Advantage plan. So you don't want to just drop all the doctors that your child or adult child love or you love or provide great care. We need to have a plan, and maybe we start replacing one person at a time. Um, so it's definitely something to think about. If you're on a family plan and you have younger children, and so you're already going to pay the family plan, then you're probably going to keep your member on that plan. So everybody's circumstance is different, but what's really important is to think about it long term, because eventually you're going to retire. Very rarely are they going to have access to a retirement plan, and you're not going to be around forever. So we want them to be on a plan using doctors that they're familiar with and comfortable with, that will be a long-term solution over time.
Cynthia, can I ask a question? Or actually, I'm not asking
Please,
a
that's,
question. Somebody
I know it's a
who's
lot.
attending live has a question, and that is, where does TRICARE, and I guess I'll add to it, VA, fit into all of this? Can you describe a little bit about the interplay with that, with all the other insurances we've talked about today?
Absolutely. So definitely for TRICARE. So there's a difference between TRICARE for life, like CHAMP VA, TRICARE, and VA. So again, I have families whose child got Medicare, they have TRICARE for life, and they have Medicaid. And you can, with Medicare and TRICARE for life, it acts like a med sup. So it opens up a network that you wouldn't generally have with Medicaid. So then the question is, how much do those extra benefits that a dual plan would give you are worth it to you over time? And what is your long-term plan of who's going to be the caregiver for your adult child, and will they be able to manage that network? If you have TRICARE and they're under 20, like if you're currently working and you're in the military and you have like one of those plans, TRICARE can be challenging too, because TRICARE doesn't always pay in a way that providers appreciate. So whenever we're talking about an employer plan or TRICARE, especially not TRICARE for life, but all the other versions of that, some providers won't accept that, or it could limit your choices. So it's, you're putting together a puzzle, and the puzzle is very specific to your child and everything that you have available to you. VA is less. So VA, you can get prescription drugs from. So if you had Medicare, Medicaid, you could use VA for prescription drugs, but the only person who can write for a prescription drug within the it has to be within the VA. So you couldn't have somebody with a doctor with Medicaid write a script and get the VA to fill that script. And once you have Medicare, your Medicaid will not pick up prescription drugs anymore. So it can be very complicated situation. And you have to really feel comfortable with using those insurances and making sure who's going to have the long-term care of your child as you pass, because we have to plan for our own passing at some point. Who's going to be managing that care, and will they understand that care? Do they have enough practice with that care? So it's complicated.
That brings up a question for me. Obviously, my role is to help people plan for later. But could you talk a little bit about the rights to speak to these insurance companies, Medicaid, Medicare, all these different agencies, and the role of guardianship, supported decision making, family friend, calling to try to help? Like, what does it take to be able to interact with these insurance companies on somebody else's behalf?
You have to have guardianship, and you have to be able to prove that, or you have to have a power of attorney, and you have to be able to prove that. I do know some people, families will call and pretend to be that person. Please don't do that. It's not a good idea. Just put the paperwork on file so that they know that you're allowed to speak on their behalf. And I would make sure that you're giving that to DDD and the Medicaid provider and the employer plan. Like, everybody should have a copy of that. And that should be readily available, because one of the things I've found is those copies somehow go missing every few years, and you have to give that back to them. The only agency I know that will not accept guardianship or power of attorney is Social Security. They will not take it. They have their own form, and you have to make sure that you do that. They don't care.
That's the
Medicare
representative
will,
AE process. Yeah.
correct.
Yeah.
But Medicare will let you, like, I've helped a wife do this for her husband. He can't hear anything. Every time they try to talk to him, he tries to ask, he can't hear anything. So we finally were able to give the power of attorney to them, and they did accept it. But Social Security definitely won't. And the health plans are supposed to ask for guardianship or power of attorney. And sometimes they'll even ask for things before they're 18. So Mark needed a medication filled. It was a specialty medication coming from California, and they would not speak to me until Mark gave them permission to speak to me. And I think he was 12. So, sometimes that happens too.
Yeah. Can you speak to a little bit more about advocacy when things are getting denied? I know you talked about it, but like, just logistically, when you know who needs to get involved, or to just pay a claim, things like that.
So, yes, that's a really good thing to talk about. So let's talk about, like, if DDD is denying something. So if DDD is denying something, you're going to ask for an NOA. A lot of times they don't give you an NOA, and that's a problem. You want it. So if your support coordinator says you can't have a service, then your next thing that you say is, I need an NOA. And that NOA will tell you how you can appeal for that service. When you appeal, I always advise families to build that medical record up and make sure you have all the documentation and submit it all together. Makes it easier when you go to fair hearing to make sure all the information that's going to support you requesting that service is entered into the fair hearing process. If it's if you're trying to get something from Medicaid and it's a healthcare situation. So let's say I'll give you an example of a friend. Her daughter was really underweight and she wanted a bunch of tests. And the doctor said no. My first advice is, let's build the medical record first. Because the doctor can't always order tests unless they have done like the initial stuff. So for her, they wanted a diary of what she was eating. They wanted her to kind of jump through these hoops, which she didn't want to do. And I said to her, you have to do it, because they can't just order testing willy-nilly. It has to be medically necessary, and they have to be able to advocate for it. And your doctor is the advocate inside the Medicaid system, especially your primary care. So this is all about building medical record. Now, let's say the doctor ordered the test. and it was denied for some reason. The first thing we're going to do is we're going to call the member service line on the back of our card, and we're going to ask, why was it denied? You would be surprised how often when you call, you'll find out that they never got the doctor's notes, like the fax didn't make it there. I recently had a client who an insurance company denied an MRI, and when we call, and it was for a serious thing, and the insurance company's like, but we have no idea why you need an MRI because they never got anything from the doctor's office. And while we were on the phone with them, they called the doctor's office, they got the fax, and they even scheduled the MRI while we were on the line with them. So don't assume that if something isn't approved that like they mean it. It could be something that simple. For me, I had a PET scan recently denied. I got the letter in the mail. I had to laugh because they already had the blood work, the biopsy. They knew they were going to have to do it. So I called and I said, I got this denial. And member services said, oh, it's no longer denied. It's under review. And I said, okay, I want to file a grievance. And I knew I couldn't file a grievance because you can't really file a grievance if you haven't been denied anything. But I said, I don't care. I want information on filing the grievance. Please email it to me. And the next day it was approved. Now, I don't know, but I just like to just do those little things to push things along, you know? Um, if you have, let's say, an employer plan and Medicaid, and all of a sudden you're trying to pick up a prescription at, let's say, CVS and Walgreens or Walgreens, and they're trying to charge you money that they can't, and it's illegal, and they're balance billing you, which is something that can happen when these systems all try to talk to each other. I would advise you to contact the carrier's GDD member liaison, because that's the person who's going to advocate inside the healthcare system around these situations. They're going to be your first go-to person. If you're fighting with your employer plan about something being approved, then it's going to be the doctor that's going to be advocating too. So you're going to want them to maybe do a peer-to-peer. That's something that's available to you. So there's a lot of things that are available to move things along. But first, you want to ask yourself, have I built a medical record for this service to be approved? Because you just can't willy-nilly decide you want something. You have to kind of build that medical record. DDD is a little bit harder because you can't always build a medical record, but you do want to build a record of why you think your child needs a service and what they're going to learn from that service. And I will always tell people, read the policy, whether it's an employer. Like if I call for something and my husband's employer says no, I ask for the policy and they'll share it with you. So I wanted to get a speech eval for my son, and they said no. And I got the policy and I read the policy. I appealed, 65-page appeal. I still got denied. But you have a 70% chance of winning the appeal, so why not try? So your employer plan will always share a policy that they're using to deny you. Um, Medicaid they have policy manuals. They have a member handbook. DDD has policy manuals. They also have provider manuals. So if you're trying to fight for a service, you might want to read the provider manual because it gives you a more detailed explanation of the services they provide and how. That can give you information to use to build your case.
If we dusted off your crystal ball and we turned on the news in the last couple months and then looked into the crystal ball, do you have any thoughts about how things might be changing?
I'm very worried. I'm worried about Medicaid over time. It looks like the cuts to Medicaid coming from the federal government are probably 3 years out, maybe more. I'm more worried about our waiver now. We had 122 million shortage for 2025. I do not believe that the 2026 budget is enough to fulfill all the services and things that our members are going to need. And our waiver is up in 2027. So I think we're in danger of possibly losing our waiver unless we do a good job of advocating, and not just advocating for more money, because that's not fair to the taxpayer. We really have to look at our waiver and look at things that we can bring to the table that would be fiscally responsible, and make it so we have to be a partner, right? We have to be a partner. So we have to work with legislators and the governor's office, and we have to be fiscally responsible. We have to look at the services that our families are using and the importance of those services. And there's some very creative things that we can do. We're actually doing research on what other states have done to help solidify their waiver. There's a program where you can, in Virginia, where they pay parents to keep their employer plans. So there's some really interesting things that we need to look at. Um, the other concern I really have is we spend so much time advocating for the children's system, and you are a child, but for a short period of time, you are an adult for a much longer time. And our adult system, in my opinion, is lacking in so many ways. And every time there's advocacy, it seems to be around the children's system. And we really need to look at the entire system as a whole, and we need to be advocating for the adults. A lot of those adults live in group homes, don't even have parents alive anymore. One of the things that I'm currently looking at is adults in group homes. They see primary care once a year, but they don't get real good medical care. When the group home drives them to the physician's office, they drop them off. The physician sees them, no one goes in with them. No one has a conversation with the doctor to talk about their health. So we're currently working on a solution where there would be a form that could be sent with them, and they could list all their concerns, and then the doctor could write on the back and go. So we're talking about like the bare minimum for adults, right? We can't even get them good primary care. We can't get them specialty care. The behavioral health services are so lacking in the adult system. And it's very hard to advocate for that when you already know you're in the hole. So I think it's going to be a complex situation. We've done it before. A lot of us advocates have been around since 2000, 2001. We've been through the recessions. We've seen cuts come and go. Um, so we have to just pull up our boots and have difficult conversations and talk about how can we make our system sustainable? How can we protect the most vulnerable? And how creative can we be? And I think there's some opportunity there.
If somebody's interested in either more closely following what's going on or themselves getting involved, do you have any resources or recommendations for them?
So for right now, I think the most important thing is to, if you have an employer plan, make sure that the employer plan is being billed first. Make sure that the employer plan is paying their fair share, right? Because Medicaid is payer of last resort. And back in the day, a lot of these services were not covered. That's why we all had to put our children on Medicaid, because we couldn't get our employer plans to provide that coverage. But now we know we have employer plans that will really pay for a lot of this coverage. So we need to make sure that those employer plans are actually paying, that DDD is actually doing TPL correctly, that they're actually paying and chasing, and that DDD is being fiscally responsible with what they're supposed to be doing. I think that's really important. I think everybody should read their EOBs. So you want to make sure that's what's being billed to your employer plan or billed to Medicaid or billed to Medicare is actually happening. So if you look at the billions of dollars that we've seen, like we have 7 people in Arizona that just got in big trouble. I heard a whole thing from Dr. Oz talking about how these sober living facilities were doing skin grafts, and they billed like, I don't know, I'm going to make up the number, 300 million in skin grafts, when sober living facilities are not doing skin grafts. So we see all this gaming of the system by corrupt people. And one of the best ways to make sure that that doesn't happen to our system is to read our EOBs and make sure that insurance companies are not being billed for things that were never provided to us.
So just so we're clear, because I don't speak insurance as much as you do, but those thick packets of paper every time I get a test, that's what I should be reading, not just putting
Correct.
it in recycling. Okay.
Correct. So I have a client right now. She just read hers, and they charge her for a catheter. So catheter, by the way, is one of the biggest areas that you see fraud. She never had a catheter. So she called her insurance company and said, this hospital billed for a catheter. I never had a catheter. So we need to go back. I have a client that called me. It was during COVID. She was charged for $700 for a COVID vaccine, which at the time it was not, you weren't even allowed to charge for a COVID vaccine. And she was actually in the hospital with COVID, so they wouldn't have given her a vaccine. So we had to call and say, take that off the bill. Like, this is ridiculousness. So you really do have to pay attention. You
Yeah.
really do.
Well, and this is a great segue to kind of wrapping things up, but you mentioned your clients, right? Like who and how and when should people get in touch with you?
So I help people with insurance. So if your, let's say, adult child qualifies for Medicare, give me a call. I will look at all the different choices and we can look at your choices and decide what would be best. If you decide to retire, you're going on Medicare, give me a call. I help people with Medicare all the time. If you decide to become self-employed, you're going to start a business and you need a marketplace plan. I help people with marketplace all the time, anything that has to do with health insurance, dental, vision, travel health insurance. I do all of those things. And I do advocate, but I don't advocate for individual cases. So I look for systems issues inside our system, then I raise the red flag and I advocate to fix the system. So I don't accept like individual advocacy for people, but if you see something that's happening, I'm happy for you to reach out and talk to me about it, because if I see that it's happening in a system-wide manner, then I can advocate within the system to try to fix that. One of the things I'm trying to work on right now is this difficulty of care income. Access keeps making mistakes and counting it as income when they shouldn't. So I'm working on that one too. So we've been working on the Medicare issue with DDD, difficulty of care income. So I probably spend, depending on the situation, 10 to 20 hours a week just volunteering, looking at the system and trying to find ways to make it work better for everybody.
Well, thank you for that. And thank you for everything today. I also want to point out to those people watching this either live or soon, once it's been recorded, that we have 2 additional webinars coming up that you've so generously offered to present. So in August, we're going to be talking about ALTCS, one of those Medicaid programs, and how particularly that PASS, the pre-admission screening or medical evaluation, is undertaken. And so that's coming up on August 8th. And then let's see, in September, we've got September 5th, we're talking about disabled adult child benefits. So hot topics, a lot of
My
overlap.
favorite. I love it all. Anything that has to do in this area is, I'm just so passionate about it and I love to talk about it. So,
Well,
so
thank you.
grateful for the opportunity.
Thank you for being so generous with your time. For those of you who might still have questions, obviously Cynthia's contact information has been up for a long time, so hopefully you've used a QR code or screenshotted or went and visited the website. But you also, of course, can reach out to either of us with any additional questions, and we'd be happy to get you pointed in the right direction or do our best to answer them. And I guess I've said it 3 times, but thank you, thank you, thank you. I really appreciate this. I learned a lot, took good notes, got things I need to go research. And I know how valuable this information is for my clients. So thank you for your time. And I hope we'll see everybody in August and September.
Awesome. Thanks, everybody.